Hey, all Montel here, and thank you so much for tuning into this edition of Let's Be Blunt with Montel, where we're coming to you from Orlando, Florida, at the Florida Medical Cannabis Conference here. And it's a really, really unbelievable conference. It's presented by the botanist and Celsius, and it's going to be featuring some really, really heavy-duty keynote speakers and some physicians who are speaking here. I happen to be doing the keynote later on the day, but I'm really excited about being here because it's affording us an opportunity to get a chance to talk to some people who I might not have been able to catch. And today we are really lucky to have the assistant clinical professor in the Division of Emergency Medicine through the Department of Internal Medicine at McMaster University in Hamilton, Ontario, Canada. He's a fellow of the Royal College of Physicians and Surgeons trained in emergency medicine with a fellowship in sports medicine, internationally known for his leadership in the clinical application of cannabinoids, and the founder of Medical Cannabis Journal Club of Hamilton, founding director at the Cannabis Research Associates, a private CRO dedicated to combating the opioid epidemic and advancing cannabinoid therapeutics, and opened Synergy Health Services. He opened Synergy Health Services, a groundbreaking clinic that was first in Ontario, dedicated solely to evaluating patients for the use of medical cannabis. His second clinic, Synergy Health Services in Burlington, opens in April, on April 19th. So my goodness, I can't say thank you enough for Dr. Ira Price. Thank you for being here, sir.
Thanks so much for having me. Wow, there's a lot of things in there I've forgotten about.
Forgot about yourself? Yeah, well, let's see if we can get people to understand who you are, where your background is. You are a doctor who literally took on, I think, the entire medical profession in Canada by stepping forward and saying, look, you know what, there's something to this thing called cannabis. They were probably saying marijuana at that time, but there's something in this thing called marijuana that has some medical efficaciousness. And I'm going to figure out what it is. Now, what actually brought you to cannabis?
Wow, he brought up so many amazing points there. And most people, Montel, don't realize that we used to use words like marijuana and these derogatory, racially, inclined terms. And I love that
people don't even know that marijuana was a racially motivated term when it started off. Correct.
I love that. I love that you recognize that and you bring that up. And that was really also that was one of the reasons as well that I came into cannabis. I'm an emergency physician by trade. Mm-hmm. I'm actually also a coroner in the province of Ontario. Oh, wow. And which I'll talk about that a little bit later when I give my talk. But I was tired. Back in 2010, we were just at the brink of recognizing that there was an opioid crisis happening. I'm an emerge doc, and in the emergency department, just more and more, we're seeing so many opportunities, so many patients coming in either acutely in acute withdrawal from narcotics, opioids, narcotics synonymous to each other. So you were seeing people either coming in acutely, an acute withdrawal, acute overdose, drug seeking. And it was really frustrating because our toolbox for the treatment of pain is so limited. It's totally tiny.
And not only so limited, but so misunderstood even by the medical profession.
For sure.
When we look at opioids and then you look at the science and the research that actually started, doctors down the path of prescribing opioids for pain, they were taught initially that was really a very short-term drug, a short-term method. And then all of a sudden that short-term method became lifetime methods for some people. Doctors started prescribing it. I think some of the original papers written on it talked about the fact that, a larger dose at the onset of the incident would help the person really forget that pain trauma, which then really helped to alleviate the pain down the point. But what we started doing is giving a little dose and another little dose and another little dose, not even really impacting the pain the way we thought it was.
You brought up again, man, I love you. You brought up you're bringing up some really amazing points.
Just so you know, I want to make sure if you don't know a lot about me, I have been involved in cannabis research for the last 20 years.
Yeah, wow.
Long before it became vogue, before people were even interested in it. I got diagnosed with MS back in 1999 and really 2000 officially. And, one of my first symptoms was extreme neuropathic pain. And I had the doctors, and they knew no better, but doctors who literally the only way they thought they could treat me was to try to addict me to as many different forms of opioids as possible, and narcotics. I was on every set that you can think of. Even back in 2000, a doctor prescribed for me Talwin.
Wow.
And a lot of people don't even know what Talwin is. There's a few
Yeah.
doctors around today that understand that
Wow.
Talwin was probably one of the first, true heroin drugs in the marketplace.
It was a derivative. Yeah.
Yeah, it was a derivative of heroin. And I was taking anywhere from 5 to 6 of those a day.
Yeah.
And to the point that I literally almost shut down my kidneys, almost shut down my liver, shut down my intestinal tract. And to the point that I had a doctor that stepped up in 2000 and a half, about 2001, who said, I'm done with you, Montel. I'm not writing you any more scripts for this because I know you've been, doctor hunting, getting some of these other doctors to write you scripts for this, and I'm not doing it anymore. I heard about this stuff called marijuana. That's what he said. This is from I won't tell you where he's from because I'll protect him, but from a very, very prestigious university in the United States. He said, I won't tell you who told me about this, but I've seen some other patients who have similar pain issues that you have with MS, and they have said that this marijuana seems to work. And I don't know what it is. I don't know anything about it. I'm going to not tell anybody I ever told you this, but you ought to go dig in and research and figure it out for yourself. So back in 2001, I started seeking out back then CBD. Long before it became
cool.
vogue, before people even understand.
Great.
I mean, even nowadays.
Don't even knew what it was.
No, and I should say I'm a graduate of the Naval Academy. I did 20 years in the military. I've got an engineering degree. I'm a researcher at heart. So I really dug in and tried to figure out what the devil do I need to do to, number one, get off of these opioids, and number two, find some relief. And cannabis was my choice. And that was back in 2001. And I have gone, I will tell you, since 2001, every day of my life with putting a cannabinoid in my body every day.
You hit on a really interesting point that brings up the concept of stigma within medicine. Back when we started, and even today, when you brought the idea of when opioids were brought to the market, there was this concept that if you hit them up hard in the beginning, they're going to get this effect where they're going to forget about their pain. It's interesting that you mentioned that. When you look at the national pain guidelines in Canada on the positive benefits of using a narcotic, the first benefit that it says under the for narcotics is it causes euphoria. Mm-hmm. That's the benefit that it talks about when talking about narcotics. But when you look about the side effects of using cannabis, the negative side effect, the first negative side effect that's mentioned, what do you think it is?
Euphoria.
Euphoria. It's so strange.
How ignorant can we be? Because the
That's
same
right.
doctor's reading the same
You
material,
got it.
go home and grab a glass of wine,
Right.
looking for euphoria.
Right.
I mean, what's the matter with euphoria?
Right.
All of a sudden, we got something that seems to have made people think that euphoria is bad.
Right.
And, let's back up again. I like to make sure that, what we do with this podcast, especially with Let's Be Blunt, is I try to bring people information to see if they can help them navigate, walking into dispensaries, walking into drugstores and places that are selling CBD, help them navigate this landscape that is really just turned into, a muddled pile of garbage, to be honest with you.
Agreed.
And so I want to try to give people information, but they don't understand that, cannabinoids have been utilized for 5,000 years.
More, maybe, yeah.
And maybe even more. Yeah, we're starting to find, pipes and things from 5,000 and 6,000 years ago.
A guy, a physician turned archaeologist back, Ethan Russo, I'm sure you maybe have heard of him. Well, I mean, he unveiled a cave of a shaman from nearly, thousands of years ago. We've been using cannabis, is in the literature for 12,000 years, whether it was China or India. I mean, that's up for debate, but, there's some mythology talking about, or whether it, in some cultures, the mythology of, of certain gods whose one of their heads was cut off and rolled into China. And that's where cannabis came from. That's 12,000 years old. This stuff we've been using for so long. And and the bodies aren't piling up. If it was that bad for you, we'd see bodies like piling up to the sky.
No
Come
kidding.
On. It doesn't make sense what's happening. Really.
And honestly, okay, we don't have to go back and throw people off and say, look, go back 5, 10, 12,000 years. Go back just 50 years. People don't understand. All of a sudden, this term CBD became this, miracle breakthrough
I know.
in the last 3 years.
It's got a good marketing agent.
CBD was discovered in 1940.
Right. Yeah, I know.
Was verified in its discovery in 1946. I'm sorry, I did say 40. 1940, 1946 or 1943 really verified as an agent. 1949, THC was discovered, but then it kind of sat dormant for about almost 30 years before it was officially designated as a cannabinoid that was discovered. And people said, okay, well, that's what causes the euphoria part of this. Must be really bad. Stop with the stupid. Nobody said, when you smash that potato up and mix it and let it ferment, there's a euphoria involved with that, right?
Yeah, and it's only in the last year that somehow in the last 2 years, maybe all of a sudden CBD, I saw this great meme that showed THC and CBD with this amazing marketing agent, you know, and that's basically what's happened to it. Yeah.
And, and we continue to ignore all the other, we know now that there are over 160 cannabinoids identified. We know that there's probably going to be about 300 of them identified when we get to the end of the day, and we still don't know and don't pay attention to the scientists. A lot of people in this industry like to quote and call upon Dr. Meshulam's name, but they don't even listen to what he had to say.
Oh yeah.
And he said unequivocally that cannabis has an entourage effect.
Yeah.
Cannabinoids do, and so therefore we need to take a look and see what they do to each other before we look and see what they do to us individually. But I'm sorry.
No, I love it.
Making sure that people get some extra information.
I agree.
We have to.
I believe in the entourage effect as well, and in the synergistic effect of all the cannabinoids. I'm a whole plant human. I mean, I believe in the whole plant. I think the plant itself is the perfect plant. So,
it wasn't until you get into the 1960s and 70s when we realized that we could synthesize things and make what we think are bioidentical molecules, which aren't bioidentical molecules. We think they are.
They're slightly off,
yeah,
right?
Slightly off, absolutely. And that slightly off is something that your system doesn't understand how to recognize.
That's right.
How stupid can we be? And we've been down this path. It's not like this is something new. Go back 40 years ago when they came up with Marinol and tried to figure out if there was a bioidentical THC. There was not.
That's right.
There wasn't.
Yeah.
And we know it wasn't. We know that doesn't have the same reaction in the human body because the body doesn't recognize it.
That's right.
And as much as we try our best to adulterate this plant, strip it apart, and turn it into something that it's not, we are going to continue to go down this path of, and I want to tell you, I think there is a concerted effort to do it this way so that in someone's mind, they can disprove the efficaciousness of a full plant that works right out of the ground, which would therefore impact the ability of pharmaceutical economics. It's all about economics. Nobody really wants to, especially when you look at it, what's happening in Canada, what's happening here now in the United States when it comes to the medical marijuana programs. Medical marijuana programs. Yeah. The programs that they have, the fact that they call it medical marijuana told you that they did that way so it failed to begin with.
Right. Yeah. We finally changed that in Canada to cannabis. But I mean, how long did it take me, standing up there waving the banners of all different colors of flags to finally get the somebody to listen and change it?
I'm sorry.
It's crazy.
I digress too much. And let's go back to you telling the story. So when did this start for you?
This is the story, though. The story is the story of cannabis is the story of people, and in my mind, it's a story of democracy. The truth is, the way that cannabis legalization happened in Canada, it wasn't definitely not a top-down approach. It is now, but it had nothing to do with governments wanting it done. Healthcare definitely didn't want it done.
Pharmaceutical industry definitely did not want it done.
Yeah, of course not. I mean, it was the economics of it was just too much. But the people said, "I've had enough."
Correct.
And the people made a change. And so in my mind, this is one of the reasons I also got into it, because I love that the people were actually able to affect change. And they said, "I've had enough."
That affected change in you because you had people coming to you asking you questions about, "Hey, doc, what's this stuff called CBD?
Yeah.
What's this stuff? Do you think that marijuana thing can work?" Right?
They weren't even taught. It's funny. They didn't, back when we started, nobody, even though the research was there, people didn't want to look at it. It's confirmation bias is what I call it. It's in science, we have a concept of when your value system, your belief system is how you identify the world. It's the way you look at the world. So no matter what evidence put before you, you're going to be like, yeah, it doesn't really change my mind.
Right.
We call that confirmation bias. And that's what healthcare was at the time. Nobody wanted to look. The blinders were on narcotics. Or, I mean, it's not just narcotics we do for pain, neuropathic pain. You're probably on anti-epileptics, that you're on all these, all the drugs, the anti-seizure drugs, all these things that we are off label, definitely not on label, and we pump them through people. And I mean, the side effects kill you. I mean, you have, but why are those blinders on? And that's the confirmation bias that slowly is coming away. So when I started, I was tired. I was tired of listening to other physicians. I was tired of listening to like the system of saying we're just going to pump people through. And what do narcotics do for people? They bring you into yourself. They cause depression. They cause hypotestosterone. Yeah, it's like in men they bring your testosterone levels basically to nothing. Your sex drive goes away. Your relationships go away. You stop working. Like there's so many problems that we had with narcotics. There had to be another way. And funny enough, out of the blue, I get a phone call one day, friend. This is back in probably 2010, and I get a phone call from a friend of mine and says, "Hey, and I was a young bright-eyed physician, and but I had also never done really well with listening to people clearly, and he said, "Hey, do you know anybody that do you know a psychiatrist?" What do you need me to? Why do I need to know a psychiatrist? He said to me, "Well, we need somebody in this country to prescribe cannabis, but we don't prescribe it at that time, and we still don't. At that time, you were making an affirmation
or a recommendation,
right? So it's
same thing in the United States.
It turned into a recommendation. The affirmation is where it started, which is so strange. It was, I affirm that you're using cannabis. A patient would come to you and say, I'm using X amount of cannabis a day, and the physician would say, well, I affirm that you've used cannabis. Like, I don't know, somehow we became a gatekeeper. We're not human anymore. We're put on these pedestals. And so, I just had enough. And I said, you know what? Well, this is something that I'm definitely interested in, but there was no experts. So I basically had to teach myself, and there were researchers, but there were no clinicians. Right. So in theory, people were looking at cannabis. It will help with this. It'll help with that. There were people doing one-offs here and there, but there was nobody in our area or in our country that was doing it on a long-term basis, willing to come up. And
at that point in time, when you started doing this, there was already 40 years of research that had been done in the United States at the University of Mississippi, 40 years of research being funded by the United States of America and Israel.
Yeah. The U.S. has patents. Patent 507.
U.S. filed its own patent that it gave itself in 1999, affirmed in 2000, affirmed in 2003. But literally, the U.S. has, and a lot of people just tuning in right now, yes, that's a fact. The United States government has its own patent on cannabinoids and did so back in 1999. It filed for those patents, and that that patent number, if you want to know what that number is, here, I'll give it to you.
Patent 507.
665.
I thought the end of it was 507.
6603-507.
Yeah,
6603-507.
It's crazy.
And that patent, if you look up the patent itself, it'll tell you on, a page, on the front page of the patent application, it has something called the abstract. And in that abstract, it tells you what the United States government had affirmed after 30 years of research, what it believed cannabinoids could do.
So why is it still illegal, huh?
It's because they recognize as much that it could do.
That's right. I'm with you on it. I'm totally with you.
And the fact that, just like the main reason why most people don't even understand why cannabis ended up being illegal in the world, it was because of an aggressive United States of America banning it after it wrote its own, law back in 1931, which was the Marijuana Tax Act.
Yeah.
And that Marijuana Tax Act was written so, and remember, it wasn't the Marijuana Drug Act. It wasn't the Marijuana Psychotropic Effect Drug Act that wants to save human beings. It was the Marijuana Tax Act.
Interesting,
and why?
Right?
Because they couldn't figure out how to tax a product that you couldn't track seeds on.
Yeah. In Canada, interesting enough, we also led the charge on criminalizing cannabis. Yes. We have a dark history in the early 1900s, full of discrimination, basically against the Asian population during the opioid riots, all that stuff. But in the 1500s in Canada, it was mandatory that if you owned more than 60 acres, you had to grow hemp.
Same thing in the United States of America. Most people don't understand the entire Revolutionary Army was clothed in hemp.
Of course.
Every tent, every rope, every sail for sailing vessels was made out of hemp fiber.
Right.
Even the Masons in George Washington's Mason group during the Revolutionary War.
He grew hemp.
He grew hemp, but he also had hemp tents.
Yeah.
The tents were made of hemp. And, a lot of people don't recognize this, but a lot of people don't recognize, but, one of the rituals of the Masons is to walk around with this little lantern and, just diffuse some, what they think is incense. That was hemp being diffused in tents back then.
Amazing.
So we got to stop with the stupidity and recognize that, this was something that, we tried to replace hemp with cotton, figured out that didn't work either.
Yeah.
So
there's nothing quite as durable.
No, absolutely. And then we look at right now, I think Levi Jeans has just decided to go back to hemp fiber for its jeans.
They're making hempcrete, concrete for homes right now. And I don't know. It's amazing.
People don't even understand that you can use the cellulose material solidified, and it is probably one of the best mediums for electrical storage.
Yeah.
So there's 2 companies that have gone public in the last year making hemp-based batteries.
Yeah, it's amazing. It's amazing.
Yeah, crazy.
So let's
all right. So you decided, okay, I'm gonna do some research.
Yeah.
You did the research, and what did you come away with when you walked out? Did you feel like, why people? I'm a doctor. They should have taught me this in medical school.
It's funny. I didn't even know that. That we had an endocannabinoid system in 2010. There wasn't a day that I learned about it in medical school, in residency, in anywhere. I had no idea that this thing even existed.
You're talking 2010, and we know that we discovered the first
2009, but
2009. They discovered the first receptor of the endocannabinol system in 1988. Second receptor in like 1997.
Our body,
our body's made this way.
We've got the endocannabinoid system is probably like the one of the largest, most complex systems that exists within our body that they've been researching forever. It's basically, call it the master regulator of bodily functions. Correct. And yet I didn't learn a single word about it when I went to school. And I'll tell you, any physician prior to me learned zero about it. And I mean,
how about the fact that even though you learned about it in 2009, I'm going to guarantee you that maybe only the physicians that are present here recognize that the literature has been out there, but I talk to physicians on a daily basis who don't have the slightest idea what I'm talking about when I say endocannabinoid system. They are completely clueless because the majority of medical schools do not do anything at all to research that system.
Yeah, I went around.
And the most important system in the body.
I'd agree. I went around which is how it started to develop in Canada through medicine, is I went around to different medical schools and started lecturing to students and to residents, and I mean I've taken a lot of backlash in the beginning from doing what I was doing, but people started to slowly recognize. I think the more progressive we became, and the new physician coming out is different than the standardized previous generations. The Industrial Revolution changed one major thing in the world, and that's standardization. And standardization became the basis for medicine. And we needed that at a certain point in time because you had to standardize. You had to lose that individuality a little bit, and you had to standardize the way things worked. We standardized, we standardized how cars are made, we standardized industry, and then we standardized medicine.
And we wanted to make sure we took it out of the kitchen.
That's right. But at the same time, you lost that individuality, and you either you're going to be standardized or you're going to be an individual. And now we're moving back to that individualization. We've had enough of these 15 laundry list of medications that have standardized our treatment plans. And we're saying maybe it's individual medicine, and people are coming around to that now. And cannabis really fits into it, which is one of the reasons why physicians have such a difficult problem with cannabinoids. And I don't blame them. We're so used to medicine having 9 medicines to treat one disease. How many medicines are you put on for MS? How many medicines are you put on for chronic pain? How many medicines are you put on when you have high blood pressure, diabetes? You're put on 5, 6, 7 different medications. You're over 65, I guarantee you're on more than 4 or 5 medications if you have one disease problem. Cannabis comes around and it shifts the entire environment. It says, I got one medicine to treat 10 diseases.
Right.
And so that shift in people's minds, specifically in physicians, it's difficult to wrap your head around.
And but I wonder though, and I think a lot of the false information and the propaganda that was put out about cannabis is part of the reason why that attitude is there. Because doctors accepted aspirin.
Right.
They accepted aspirin. Aspirin is made from willow bark.
Right.
Back from 1901.
And doesn't have a DIN number.
Huh? Yeah. From 1901 to about 1920, people were making their own aspirin in their kitchens, boiling the willow bark of the tree out in their yard and killing themselves because they were bleeding out.
Yeah.
Right? So then somebody said, wait, you can't do that. So you can't make any more aspirin at all in the world. We're going to have this company called Bayer do it. And it was not even a scheduled drug. Yeah. Until 5 years ago, 10 years ago?
Right. Well, it's still over the counter. It would never be today if it wasn't back then. It would be, kills more people than cannabis every day.
Kills more people. It's the only drug in the country, in the world, that you can literally send a child down to a drugstore and can purchase.
Right.
That child can purchase it, come home, take a half a bottle, and be dead on your kitchen floor.
It's also the one drug killer. So we have a list in medicine in the Emerge, the different drugs that kill people from taking one pill. On the pediatric list, on the kids list, it's a one pill killer, aspirin. And you just in your kitchen, you just go over to the store, buy a bottle of aspirin.
Correct.
And seeing a salicylate overdose or an aspirin overdose, I mean, these things kill people very quickly.
Yes. Yeah, but
somehow it's okay.
But it freaks me out though that there are still doctors who are so adamantly against the science.
So confirmation bias is what it is. So that's the stigma that happened because of the reefer madness and because of the way that they were brought up. I'm sure we all come to the world with our own biases, the way we see the world. And physicians are no different, right? They have these biases that we slowly have to chip away at. And those are the things that I've been, that I work on. I go from their angle. I come into it as a physician and I talk to them about the science. I'm an evidence-based physician. Hamilton, McMaster University we're the founders of evidence-based medicine. Harvard has based their medical school on us. And, the rest of the world has adopted evidence-based medicine, Gorgayat and all these guys, the evidence-based guys. And so what I've tried to bring to the table over the last decade is evidence-based principles to plant-based medicine. That's how we're going to make this change, right? We no longer have to be in our kitchen and doing individualized medicine under the covers. We can bring individualized medicine with those evidence-based principles without doing massive randomized control trials. These randomized control trials that everybody talks about, we can't use cannabis because there aren't massive randomized control trials. Who invented that randomized control trial?
The pharmaceutical industry.
Yeah, of course,
so
to keep everybody else out because they're too expensive.
That's right. So has a butts.
Right. So now we're doing, the research world looks at serial N of 1 trials. So I'll take lots of 1 individuals.
And if you look at lots of N of 1s, there are hundreds of thousands of N's of 1s in the world.
And put those together. So the research world's looking at N of 1 trials now. We call them serial N of 1 trials, but they look at it in the cardiology literature. They look at it in the respirology literature, and somehow it's okay. Cannabis, we're not really sure how to do it. How do you blind somebody to cannabis, no cannabis? I'm doing that in my studies now. Somehow, in order to get DIN numbers, they want these RCTs with placebo effect or placebo arms. Does that make really any sense? No, because it's got to be real life. You need functional outcomes. You need real life data, real life research. And so it's a total shift. It's a paradigm shift, and it's difficult for physicians.
When you say a paradigm shift, this is one that's, governments from the FDA in the United States to, the Canadian regulatory offices, people don't want to hear N of 1. They want to hear it. They want you to have spent something. I'm involved in a medical device company right now that's literally deployed over $100 million right now. We got full clearance in Canada. Right now, we are treating patients in Canada in 7 different centers of excellence across the country. 7 of them right now. The United States of America just denied us FDA approval for a class 2 device.
Really?
Yeah. Only because they and are expecting us to spend another $50 to $60 million to do another randomly controlled trial for something that really does no harm. They've already proven it doesn't harm. They've already given it a class 2 status. Yeah. So why can't we just help people. We can look at cannabinoids and understand that in the history of mankind, since the dawn of man, no one has died from an overdose.
Yeah.
Not one individual has died from an overdose. And
directly related to it anyway, yeah.
Correct. Now, we do have one death in the United States that now people claim it was directly related. But we're not even sure if that was true or not.
I don't know.
That was a mold-based problem that had something to do with the negative effects of a pre-existing condition.
But it's still one person. 100% of people over the age of 65 are going to have a significant side effect to a narcotic.
Correct.
I don't understand the concept anymore of somebody saying, oh, it causes this side effect or it's caused one death. It's okay. I'll show you the one death every single day, every 3 hours from the opioid. As a coroner, Ontario has the largest coroner service in North America. So you have to be a physician to be a coroner in our province, and we go investigate death. And unfortunately, the city that I live in has relative per capita has the largest problem of opioid abuse in the world. Oh. Canada has the largest opioid abuse problem in the world in general, and then Ontario the largest within it. My city happens to be within it. The average in Florida, for example, is 7 deaths per 100,000. 5 deaths per 100,000. Ontario, its average is 7. My city is 15.
Wow.
So it's pretty high. I'll tell you, every 1 in 3, at least 1 in 3 of the cases I'm going to see as a coroner is directly related to an opioid. So if you tell me there's been one death, I'm sorry that happened, and it's really unfortunate, and I'm sure there were other circumstances around it, because I guarantee you it probably wasn't a simple case of, I vaped too much or I smoked too much or ingested too much. There was probably something else around it, but it happens. It is a drug after all. There are side effects. We have to be careful. But on a scale, and not even relative scale, on an absolute scale, you're talking apples and oranges.
Correct. No ifs, ands, or buts.
Yeah.
I was fortunate enough to, I've done several shows with Dr. Oz in the United States. Yeah. One of the first shows to actually take on cannabinoid or cannabis. 5 years ago, I did one that really, I think, was one of the shows that actually helped to stem the tide in America, because when we walked out of that show aired 3 times, and at the third airing, it changed the people in the United States in polls from under 50% of people supporting a medical marijuana initiative in their state to over 71%. But then I also did with Mehmet 3 years ago, one of the first shows done nationally on cannabis as an exit drug for opioid addiction. Long before it was being talked about on the air, I sat down with him. We brought 2 doctors on that had done some research and understood very clearly that cannabis could be an exit drug for opioid addiction. And yet still now today, we're just now starting to hear people catch up. It's,
that's what I'm talking about, is cannabis for opioid substitution. That's really where my heart is, because, we see it so often. I'll tell you about the stigma around it. Even just talking about it in the literature becomes difficult. So we just finished a 1,202 patient study on cannabis for opioid substitution. It's an observational cohort, so real life patients. Yes. Overall, there was 82.5% of patients who were in the study were able to reduce their opioid use. 58% of them were off of them 100% within a year. Getting that published is super difficult. So we go to the 2 top journals. There's always, you want to go to a high powered journal. The second highest powered journal, their response was, well, there's too much bias. You used cannabis patients. Sorry, what? So what patients am I supposed to use? The patients that aren't using cannabis?
Right.
The stigma that's still around it. And even better story than that is I was looking for a physician to work in our clinic.
Well, but part of that answer is also because of the price tag basing opioids compared to cannabis.
The stigma just still exists out there. It's definitely decreased. When I started, I was looking at about a 97% self-referral rate over to the clinics. And now I'm looking at about a 99.5% of patients are referred by other physicians to the clinic. They've had enough too, right? People are starting to come around. They're seeing the toll of narcotics and neuroleptics and anticonvulsants and blah, blah, and muscle relaxers. Benzodiazepines are probably more dangerous than narcotics and alcohol combined.
Since the whole discussion,
no one's talking about it really.
Since the whole discussion about opioid addiction, in the U.S. national media to date, in the last 3 years, the
benzodiazepines, muscle relaxers.
The muscle relaxers, the prescription of those has now quadrupled.
Oh yeah, and they're worse than they kill. They kill the same way alcohol kills. They work on the same mechanisms in your body that alcohol works on. Opioids kill you if you overdose and they decrease your respiratory system. But you take too many benzodiazepines or muscle relaxers, you die from withdrawal. You don't die from withdrawal with an opioid, with a narcotic, but you die from withdrawal from a muscle relaxer in the same way that you can die from alcohol withdrawal. And people aren't really talking about that yet, but one of the major things that cannabinoids do, they act as a muscle relaxer, right? Because cannabis can do that. CBD can do that. Even THC at certain levels does that, and different, other cannabinoids do as well. But we haven't really started talking about that too much yet, but it's coming. The problem is legalization itself has really taken away a little bit of the medical talk. Why? Because of the economics right now.
Absolutely.
And it's becoming difficult.
As soon as we started to legalize, then everybody's attention went from research to how much money can I make?
It's nuts.
And that's it's like conferences like this. I love the fact that we're getting together, but unfortunately, there are a lot of people who show up to conferences like this just trying to figure out how can I make more money?
Yeah, when they come in.
How can I make a bigger buck? They're not here because, one of the things that I've said since day one, and again, I've been advocating for cannabis now for 20 years, from state to state to state to state to state, helping states.
A lot longer than I.
Write legislation, helping people, because I feel very, very strongly about the fact that I have a right to my own personal conversation with my doctor.
Yes.
I don't need anybody else to be in the middle of that.
That's right.
And, so if a doctor has the right to prescribe for me, something like, chemotherapy that will burn me from the inside out, and he's supposed to be educated enough to understand what those benefits and risks are for that. If that same doctor who's studied and understands cannabinoids recommends that to me, how dare you get in between me and my doctor?
It becomes a really big problem. Federally, I was just talking to another physician here yesterday. Federally, because it's still illegal, although now you can economically interact with cannabis now in the United States. You can do money transactions, yet it's still illegal. Anyways, the physician is really scared, and there's a big discrepancy between government and regulatory bodies. They're basically they fight with each other all the time, and they're all trying to figure out their own way to a common path. But in the meantime, who's being forgotten? The patient.
Correct. Leave the patient. I was going to say, leave the patient on the battlefield.
That's right. The patient sort of gets stuck in the middle here and going, yo, what about me? I'm the one over here that that needs this. And you have the physician saying, I'm just trying to keep my license. And you have the regulatory body saying, I'm just trying to take it away. And a government saying, well, it's all illegal and you're all going to jail. So, and the patient saying, but I'm the one dying and don't you all represent me? And so it becomes a really big, it's a big problem. It's a big cluster right now, and that's what we're trying to get around. Now, interesting in Canada, I had a good friend of mine, Abby. I'm sure you may have she's maybe been on your show. Who knows? Abby Roach, good friend of mine, started a company called Hotbox Cafe in Toronto back in 2003, the first cannabis lounge in North America. And she just it was in Kensington Market, and she said the revolution is over. Join the evolution. So now we're in the different phases of cannabis legalization and cannabis progression. And there's, and I'm hopeful that through the evolution, much like somehow when alcohol prohibition ended, we used to have to go stand in these lines in the stores and there was tinfoil covers over them. You give them a ticket and they give you a bottle of beer. Eventually these things will hopefully change. What I hope we don't lose is that cannabis is a medicine, and cannabis can revolutionize the way that we treat both from a physical and a like a metaphysical sense of medicine, because now the plant itself teaches us that collaboration is key. Medicine has this concept of this big, I'm the paternalistic, ancient patriarchy, take your pill, go home. Cannabis,
take the pill only if I've isolated that one component and made sure that I have a patent on it. Yes, take the pill.
Take the pill. And cannabis comes around and says, well, I'm a plant and we have to work together. And the only way we're going to succeed is if we work together, because everybody doses slightly different. Here's a little template. And that teaches medicine. And that's difficult for physicians too, because imagine you're a patient or a physician and your patient comes to you and tells you there's an endocannabinoid system and you feel like an idiot because you had no idea that it existed. Correct. And your patient knows more than you do. And physicians, we're by nature, we have a lot of, there's a lot of ego involved and they get defensive right away. And so they say no. It's not because they necessarily want to say no, it's because they become defensive. Correct. So these are the barriers to access we're trying to break down, that I've been trying to break down for about a decade.
And I mean, just talk a little bit more about the difficulty when you go to conferences like you're speaking today. You'll be speaking here in front of probably a room full of doctors, physicians.
Yeah.
And so, these are guys who, again, you're preaching to a choir in a sense when you're here.
Right.
But what's the difficulty you run into when you go to, like, say, a university and put on a lecture and there's the room full of people who are not,
this is
cannabis packers? This
is exciting. This is easy.
Reaffirming.
This is reaffirming, better word. This is reaffirming and a lot easier to talk to here at a conference that is based on cannabis, and you have a lot of cannabis advocates at. It's a lot easier than where I started. And I remember my first lecture. I've given hundreds of lectures since, like, let's say 2011 is when it really started. My major first lecture was emergency medicine grand round. So like all the physicians from the whole region show up and they sit around this table and you're talking about cannabis. And at the time we were using the word marijuana. First we didn't, and the way to destigmatize then was putting an H instead of a J. Like we were still trying to do things. And I mean, these guys would sit around and they were literally yelling at me as I was, as my conversation started. But what I loved about it, some of my favorite lectures are where I have these guys who are just about to retire. They could care less about what wow, I haven't sworn, and I usually swear like a man. I'm super like conscious about that. Cool. Because I was about to do that again and I'm like, probably shouldn't do that right now. Anyway, back to what I was saying. These guys sitting out there, these old guys just ready to retire in their mid-70s. Physicians don't retire, they die when they retire. That's basically what happens to them. And so these guys sitting there, when you start, I want nothing to do with cannabis, and I'm too old to make a change, and I don't care what you say. You can say whatever you want. I've had guys like literally during lectures say that. And, but by the end, they're the guys with their hands up saying, sorry, you say you can help with, gastric acidity. You can get it's weird. Out of all things, like family physicians somehow love getting doctors off of proton pump inhibitors, the antacids that stop the acid from building up, because they have side effects themselves, and so for some reason they're like, oh, you could get my patient off that. Okay, well, I'll give it a shot, and all of a sudden they see like the 10 other medications coming down, at least going, minimizing or decreasing doses of them. They see their patients going back to work, being productive in society, like, okay, maybe it's not so bad. And those are the conversations that I actually love to have when they have these doctors that are, I don't care what you say. And all of a sudden they start changing. But I mean, when I started, I basically felt like I was waving the banner of every color of a flag, staying in the middle of a highway. It's how I always explain it. And cars trying to smash you, coming on either side, and you're dodging. And that's what it felt like for probably, I would say, 7 years. It wasn't until like 2017 that physicians started to pick up on it, and in a large way. In a positive way. And that's because of the work like yourself and other people around, the country and North America started to buy into it because they had enough. Right. And really the opioid crisis did start helping, but we've had an opioid crisis for so long, and it's it's still rising. I mean, it hasn't gone down. We're still going in the wrong direction.
We're such media junkies, and we're such and I often give credit to, and I think he deserves it, is Sanjay Gupta for his special that he did. But his special also did as much damage to the plant as it did good.
Yeah.
Because it identified this chemical CBD, and everybody jumped up and down on this bandwagon of CBD as ignorantly as possible.
Right.
I even had a conversation with Sanjay, and if you looked at his last special that he did, which was number 5, you know, in the last 5 minutes of that special, he went back and retracted what he had said earlier about THC being bad, but nobody really caught on to that. It was such a small segment where he's offered the fact that now there's some research saying that THC may be a compound that we need to pay a little bit more attention to. Stop. We've been paying more attention to it for the last 30 years.
Yeah. It's so unfortunate.
How many more years? It drives me nuts.
Yeah.
I absolutely go crazy when I want to do a podcast with a doctor who comes and says, well, Montel, I mean, I think this is something that we just really have to have more research on. I mean, the research is excuse me?
I know. It's ignorance.
You're a doctor and you go to CMEs. You understand that you could just go back and request all the data from the University of Mississippi alone. I'll give you a year's worth of research to look at right there.
There's databases on that. There's more research for cannabinoids than there ever was for a narcotic.
It's been out, and it's not like it's narcotic research is probably I'd say 15 years.
And it's still no good.
It's still no good. But the last 15 years, there's been some really good research done on narcotics. Research is being done on cannabinoids since 1940.
I know. It doesn't make much sense, right? Our world is...
But somebody's just said, but we need more research.
Yeah.
Really? Well, when they say that, I'll ask the same question. Did you know that CBD was identified in 1940?
Yeah.
No, it was identified in the last 10 years. No, it wasn't. It was identified in 1940.
Yeah, it got good PR in the last 10 years.
Yes.
Physicians ask me, and even general public come up to me, oh, yes, you're a physician, you prescribe cannabis. Oh, you prescribe the CBDs. They can't say CBD. It's CBDs.
Yeah, CBDs.
It's CBDs. It's somehow the CBDs. It reminds me of my football players. I used to work with pro football as a team doc.
You do work in professional. I want to ask you about that too. Let's talk about that.
And one of the major reasons I started getting into cannabis was actually because of I was working with the CFL, the Canadian Football League, because of the footballers that would come in, and it's not their fault. It's a systemic issue that starts from college onwards, even high school onwards. Coach says, go, go, go. You're injured. I don't care. You got a head injury. You got an arm injury. Oh, let's inject it. Let's move on. And there's always the fight. But these guys after a game would come in and they don't even know the name of their pills. They'd, doc, give me the home plate. Yeah. And they're looking for their muscle relaxers, right?
Sure.
Because it looks like a home plate. And they would just be like, and docs, these things are handing them. I'm like, why are we doing this?
I've been interviewing several football players, especially this last year. And, look, we had big Super Bowl, and now all of a sudden the NFL in the United States was talking about expanding the number of playoff teams so that they could have more money, have more games out. Yeah. But what people don't understand is that these guys line up in a line before the game to walk past a doctor who shoots them in the butt with tramadol.
Yes.
So that they can go out on the field and get their heads busted just for your enjoyment.
And an anesthetic in the shoulder.
Correct.
I guess see it all the time.
That same doctor would say, no, I don't want him smoking or utilizing any cannabis at all. What? Excuse me?
Yeah, they don't talk about the GI bleeding, the gut bleeding you get from Toradol, but that kills more people a year than even like just an NSAID, just a regular Advil kills more people than cannabis does.
Absolutely insane.
I mean, it's kind of sad. I mean, you have to laugh at it at some point, but the stigma is real, and we see that, and that was actually one of the reasons I got into it, because I saw this happening. I kept going to the doc, like the head team doctor, who's one of my mentors. He was with the team for 49 years. He's an amazing human, but yet this is the standardization. It was like the pass these little envelopes for going to players and just so that they can play. And I finally just go home and smoke a joint, Brett.
Correct.
Like, just go home and see what happens. And all of a sudden you see like the rest of what I could do that, doc. I've been told. And until like cannabis is allowed in the CFL, and it's especially on off season, and they weren't testing for many things until a couple of years back anyways. And so eventually you start seeing players be like, it's all I really needed. It's all I really needed. And the question was why. And so we started looking into all those things too.
And the research is already there. It states that there is a neuroprotectant capability in cannabinoids that we haven't really researched the way we should have.
Oh, yeah.
And should be, but we know that it exists.
The plant itself is a perfect omega-3 to omega-6 fatty acid. We know omega-6, both of them, omega-3s are neuroprotective. And the plant itself, just eat the darn plant. That's why this plant is a really excellent it's almost like a perfect plant. The whole thing can be utilized, and it teaches us so much.
We know that back in before 1900, I mean, majority of people in the United States and North America and around the world consumed a porridge. If you had a porridge, it had hemp seeds in it, because people, when they first identified the fact that hemp seed was one of the highest protein-laden seeds on the planet, they started eating it. For a plant-based diet.
It's hard for physicians to bring their minds around an idea that a plant can, in its natural form. Most of our medicines come from plants, right?
Synthesized from plants.
Or synthesized from plants. But it's hard for physicians to believe that a plant in its original form is useful, because otherwise you're talking about naturopaths, and to traditional MDs, that you say naturopath and you think, anti-vaxxers and all this stuff. That's crazy, but it's not necessarily true, And so that's the education. It's education, and it's smart education, and it's people talking about it in an intellectual way, and it's decreasing the stigma and not using words like marijuana and stoner and weed and bringing it really to the forefront in a professional way that's really helping to make change.
So, and I think that's probably what still again, is one of the biggest issues with the entire industry is the lack of education, not just from the physician standpoint, but also from the consumer standpoint.
Yeah, certainly.
We fail to educate the consumers out there and make them understand the viability of this as a choice that they want to make. That's again why I do this. Now, tell me a little bit about Synergy Health Services.
Oh, so Synergy. I mean, I started Synergy. That was the clinic that I opened back in 2000, and I think it was probably 2011. I initially worked out of a pain clinic. Funny, I was kicked out of the pain clinic for prescribing cannabis to patients.
What?
It's really unfortunate. I got this nasty letter from the owner of the clinic where I was working prior to and seeing patients and helping them get off the narcotics, and said, "Oh well, I keep wanting to publish that letter. You've got patients outside that are partaking in marijuana, and we don't want that here, and we're asking you to leave." And so and instead we're gonna shoot you up with drugs and call it a day. And so I went and opened up a clinic, but there were no clinics in Canada at the time that were doing it on a long-term basis. There was one out of British Columbia,
out of the Vic,
there was
Victoria Island Compassionate Club.
There is. Compassion clubs have been there for a very long time, but physicians doing it on a regular basis out in the public, in the public side, didn't exist. There were compassion clubs were there far before I was there, and there was advocates that whose shoulders I stand on and paved the way for me to do what I did, and I'm grateful to them. But as a physician, there were no physicians in the clinical setting that were saying cannabis, let's get them off that. There were researchers, that were out there doing a lot of research, but not prescribing it on a daily basis. There was a guy by the name of Kevin Canerva, an amazing guy, had a clinic called the Do No Harm Clinic in Victoria, British Columbia. And he's an amazing guy, but his college stopped him. And I don't blame any physician for stopping when they're told to stop, because their license is on the line. College, asked, I've been investigated for 8 years running because of what I do. And I don't blame the college for trying to figure out, where, they got caught in the cluster of this whole thing as well. But I didn't stop. And so I started Synergy, which initially was, we needed a place for patients to come and the community to come to, one, get access, two, to create guidelines. And so I did create some standardization within the industry while maintaining an individualized medicine plan for patients. And so we started off as this clinic that was dedicated to decreasing the barriers to access for cannabis in Canada. And I had patients coming from all over Canada at that time, because there was really nowhere else to go. And I believed in applying evidence-based principles, and not just, these docs on the corner that were, "Oh, hey, what should I give this person? Okay, here's 20 grams a day. Go grow yourself 3,000 plants." And, and so I started creating some standards, and that's what Synergy was really recognized as. And eventually realized that, cannabis isn't the goal. Cannabis is the modality to get to the goal. And the goal is a functional life, is improve functional outcome. Are you functional again? Are you going back to work again? Are you able to walk? Are you able to get out of that chair and be active and speak to your family members and your loved ones? That's the real goal. So eventually I sort of transitioned Synergy into a natural pain and wellness center where we work with different modalities like mindfulness training and using cannabis in that setting. And eventually I'm going to move into other plant-based medicines as well. And because I really believe we can bring those back. It's just hard for, people to come around to it, more clinicians to understand that plant-based medicine and natural, pain, natural remedies and wellness is an actual thing in medicine. Medicine is so focused on disease treatment. And at one point we had to. People were dying of polio. We needed those treatments, but we're beyond that now, and we need to progress. And so that's hopefully, and that's where Synergy sort of sits in that closing those gaps.
So you still have one office open.
I have two. Yeah, no, Synergy, the Burlington clinic actually opened in April 2017.
Okay.
But again, I never really focused on the economics as much as the rising tide floats all boats kind of thing, where I spent my time educating physicians and really growing my competitors so that they would come out and start educating. You don't have a movement if you're one person, then you're just a crazy person.
Correct.
And I was tired of being the crazy person, so we had to. I still am.
The rising tide lifts all boats.
Right. Yeah. So I started educating other physicians who opened clinics, and then other people, and then eventually the tidal wave took over, and so I opened 2 clinics, and that was that was it. That was it for me, because my time was spent educating other physicians and consulting and stuff like that. But I've probably seen, patient visits. I'm probably about over 120,000, over the last decade. Wow. And still going. I've cut back a little bit on how many patients I see. And now with legalization, it's a little different, but yeah, that's where Synergy was.
But even with legalization, what's so weird to me is that, again, we went directly to legalization and stopped educating.
Oh, this is what I wanted to bring up when you mentioned it. Not many companies see the value, still don't see the value in education. They don't want to spend their money on educating populations, media, even their own educators who aren't educated in some of these companies, and everybody all of a sudden is an expert.
Right.
They've been in the industry for a year.
Can't tell you anything past CBG.
Right. Yeah. And that's it. Yeah. Oh, they're what? Even CBG is like, let's not go that far. You've gone down the hole. They don't know what that is. They're still saying CBDs.
I've been talking about what's really kind of crazy is, I'll tell you, I have my own brand. Yeah. I've had a brand now for 4 years, and 4 years. And when I first introduced that brand, I went to a contract manufacturer and had a partnership with them. I'm about to shift over to a different manufacturer now. But the initial conversation I had was all they wanted to say was CBD, 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 CBD. And I was like, calm down.
Yeah.
Dude.
That's good.
It's really nice, but I don't want to make a formulation that is a broader spectrum. And I really think that what we're going to find out, and you're going to find out in the next year, and I said this 4 years ago, in the next year, you're going to find out that there's another cannabinoid called CBG that's going to end up being more important than CBD, or at least as equally as important, especially in a, if you want to make sure you have a broader spectrum and interaction, you're going to need CBG. Well, why? What's this CBG? There's nothing like CBG. Then now all of a sudden, everybody and their mother, that's all they're talking about now, CBG.
The synergistic effect. And yeah, absolutely.
It's crazy.
It's unfortunate. I mean, it's fortunate we're still moving along, but the experts in the field, they've been in the field for 2 years. Right. And it's sometimes it's frustrating, right, seeing this, when I come to conferences and everybody's the damn expert and they're all spewing some literature, but don't, like yourself, don't have that grounded understanding of cannabis, and it's just something they read yesterday and all of a sudden they're the expert in it. Right. And it's super frustrating seeing that sometimes. I'm glad that they are talking about it at least, and they want to be in it. Right. But I talk about mindful consumption. It's a concept that I talk about when talking about cannabis, but it applies to the whole industry. Your intention has to have purpose. Right. If your intention is to get high, I mean, that's still a purpose behind your intention, but the the intention of even the economics of it, it's for the betterment, I think, and that's what cannabis is really all about, and we're losing that.
I also think that what people don't understand, especially when we even think in terms of this recreational or just legalization for recreational use or adult use, people don't understand a person who makes a choice to consume cannabis over alcohol, let's say, 9 times out of 10 may not even know that their reasoning is medically based to begin with.
Yeah.
I don't believe that there's really that many recreational users out there. I think that they're all a medical patient that's looking for some cessation of some symptom that they don't get from other things that provide them a euphoria. So I make a choice to stop drinking, 5 shots of alcohol all night and shift over to cannabis because it made me sleep better.
Yeah.
I woke up without a headache. Well, maybe the underlying medical reason was I didn't sleep good to begin with.
I think there's one good reason to use cannabis recreationally, and that's to get high.
Right.
And other than that, and that's fair.
And even if you do that to get high, you made the choice that high is better than a beer high.
Right. Or you just enjoy it. Like, that's
Correct.
okay. That would be and there's nothing wrong with that. Anytime somebody tells me other than that, it falls under medicine.
Yeah. And but even when I look back, I gotta tell you though, from my perspective, let's go back in time. Let's go back again to that 1590,
right.
1601, 1602. People were wiping their butts with leaves, man.
Yeah, I know.
I mean, come on. There was no air conditioning. There was no heater.
Yep.
I got up in the morning and I tell you, I got up in the morning. I had chiggers. I had bites all over my body. I didn't feel good.
Right.
And I wanted to feel good.
Yeah.
Now, you might say I wanted to get high. No, I got tired of scratching.
That's right.
Okay, so there was a reason why we were using this thing. I mean, life was not pleasant back 400 years ago. People might lie and think it was. No. You had no toilet.
I know.
You had no bathroom.
Yeah.
Everybody drank beer.
It's funny.
Everybody, most people don't even recognize the fact that water consumption back then was near beer. Every water that was consumed was processed with alcohol to kill the bacteria that were in it that were causing people all this dysentery and all this other crap. So, people were walking around there with a mild...
And they were dying when they were 25, 30 was the average age. It's funny, you remind me, it's totally off topic, but when people talk about nutrition and we talk about like, oh, this is what we did when we were cavemen and when this is the plant-based medicine everybody did, or the meat people when we're talking keto or plant and all this other stuff, and this is what we did 400 years ago. And I'm like, yeah, you also died when you were 20 years old. You're lucky if you made it till you were 10.
Right.
We need to understand that it wasn't all, puppy toes and rainbows.
Correct. Absolutely. Absolutely. We'll talk about anyway. We're almost out of time.
Yeah.
So
okay.
What's coming next? What do you think? What's some of the new cutting edge research that you're doing?
Well, cannabis is evolved. And I mean, my goal now, I think, is
evolution.
Is evolution.
Right.
And the evolution of cannabis, I think, goes into all of plant-based medicines as well. I'm moving into psilocybin as an area of research as well. And that's because, for hundreds of years, we've been using these things of medicine, using these products as medicine, but we haven't had the opportunity like we have now, which is to apply evidence-based principles to them. So everybody until this point was like, it's just that. And then, came 100 years ago with the institution or the industrialization and the standardization. And now with evidence-based principles, everybody got so focused on these, on pharmaceuticals, but we forgot about the plant-based medicines. So now we're at a point where we have that opportunity. We have the opportunity to apply the same principles that we did to pharmaceuticals that were killing people to plant-based medicines. And that's really what my goal is. So the first thing that and right now what I'm focusing on, the study that I'm doing, is cannabis for opioid substitution therapy. Put on by this, sponsored by an LP licensed producer, the guys that produce cannabis, called NGC, Northern Green Canada. They and we're looking at what cannabinoids. Initially, we were looking at does cannabis help and which chemovars or strains. All of a sudden, everybody's talking about chemotypes and chemovars. Like overnight, everybody became the goddamn expert again.
And nobody wants to recognize the fact this all started with 7 different plants, probably 7 or 8.
So nuts.
And all we've done is it's like what color pink rose?
Yeah, I know. all of a sudden people are talking about this. It's insane. And then they sound like, oh, we're the genius because we're using these scientific words. Anyway, so we're looking at these strains. Let's call them strains. I don't care. And we found a specific formulation that we're going to be putting into trials to now see if there's a causal relationship between decreasing opioids and cannabis use. And that's really like where my goal is to decrease, is to play just play my own part in decreasing the crisis that we find ourselves in now, and bringing plant-based medicine, a safer alternative into medicine, while at the same time understanding that medicine is not just this ancient patriarchy, and it's a collaborative process, and I'm going to empower patients to make their own decisions, and I'm just here to help them. And so that's really what I'm trying to do within medicine right now. I mean, unfortunately, the economics in Canada and everywhere else, everybody's trying to make a buck. And when you think about making a buck first, you're going to implode. And you got to hit the passion first, and you got to have, you got to care about your patients first. I always talk about patient, product, profit in that order. And you really need to focus on that. And so I'm really trying to do that now. The industry has basically imploded on itself in the last 2 months in Canada. Everybody's fallen apart pretty much. Legalization sort of, brought on a whole new slew of problems, and the industry starting to correct itself. For me, I think research and data is the key. And in real time, so functional outcomes in real time, not in a laboratory. You got to do your studies in the community to find the results, and that's really what I'm trying to do. And sponsorships for studies is really difficult to come by, because LPs in Canada are just they're trying to make their bills tomorrow. They're not seeing 2 years from now. They're just trying to grow cannabis because they got no money for research, even though that's where the future is. So trying to raise funds for research, and I truly believe that they're, cancer, it's not prime time right now, that using cannabis to cure cancers. But I do think that we can revolutionize medicine with cannabinoids, and that we can get there if there was enough money put into it. And studies were ongoing, specifically around glioblastoma and stuff like that. That's really where my thought is, and that's where I'm heading.
That's unbelievable. If somebody want to get more information from you or about you, where do they go?
Well, I think Instagram is probably the best place. Dr.Ira Price. That's where I am on a daily basis. You can also watch. I have a podcast called The Higher Estate.
There you go.
And we bring in physicians, and we bring in people and talk about education.
Absolutely.
Those are basically the two places. I'd say Instagram is probably the best to start.
Cool.
Dr.Ira Price, and you can find out what else I'm doing over there.
Well, sir, I can't thank you enough for being here and being a part of living. Let's Be Blunt with Montel. And I'm out of time, so I want to make sure that again, if you want to get more information, it's
Dr.Ira Price.
Dr.Ira Price on Instagram. Go on up and get some more information about him. Really, really wonderful to have you. I want to have you back sometime.
Yeah, thank you so much.
We have so much more to talk about.
Like tons.
Tons more.
It's enlightening to see what you're doing and the impact that you're having. You have a voice that hits millions of people, and you don't see it every day. People willing like yourself to come out and do that. So That's incredible. Thank you.
Thank you. And thank you again for tuning in to Let's Be Blunt with Montel. And make sure you know that you can just click on right here in this lower right-hand corner, and you can subscribe to the Let's Be Blunt podcast. And make sure you do so, because if you subscribe and you write a review, you will then have made yourself available to be able to win one of our magic butter makers. Oh yeah, $200 value. All you got to do is subscribe to win.